Housing Options was created to enable individuals with a mental illness to have their own place to call home in their own community. We believe that individuals can and do recover from mental illness when they're provided with a roof over their head and services that support their recovery. Our objective is to strengthen the breadth and depth of our work without compromising quality. We aim to increase our housing capacity to address our consistent waiting list, to develop increased opportunities for our participants to actually leave our housing while continuing to be able to live in affordable housing in the community with our support services. And finally, to fully integrate primary health with our behavioral health services. For 25 years, we have been saving lives that otherwise would be lost to homelessness, mental illness, and substance abuse. We're able to save lives because of our commitment to evidence-based work in our housing, clinical, and support services. The starting point of all of our work is providing a roof over someone's head. Without knowing where you will lay your head at the end of the day, it's impossible to change anything else in your life. Our Housing First model gives individuals the safety and security to then choose to create change in other aspects of their life. Our commitment is to best practices and the implementation of those practices at the highest level possible. Effectiveness is best achieved when we engage the talents of everyone on all levels, including our participants, board, advisory, volunteers, and the community at large. We are rich in support of community members that bring their time and talents that we might not otherwise have within the organization. We measure the success of our work across all aspects of the organization. Our dashboard of organizational health includes metrics for clinical and vocational, housing, financial, board, and personnel. A few metrics in these areas include success of our participants' self-identified goal attainment and our goal of giving them a home within 30 days of their application. Our participants themselves are the most misunderstood element of our organization. Persons with mental illness are often thought to be incapable, unpredictable, and are feared. While we view our participants as fully capable and talented and able to live independently, having a mental illness often carries stigmas and creates barriers. We have a long history of achievements from our inception of standing against great community opposition, because advocating for affordable community-based housing for people with mental illnesses is not always easy. Our best practices and model of wraparound services are generating positive outcomes for our participants. Organizations from Illinois and across the country have reached out to us to seek better understanding of our work and how it might benefit their community. We have long faced the challenge of not having enough housing to meet the demand. Our waiting list is constant, and we receive more than 21 calls per week requesting housing. Affordable housing that is sustainable is the key foundation to providing the life-saving services that we offer. Without the housing, hope does not often follow. We've strengthened our program model, and it's now essential to build organizational capacity and infrastructure to sustain our long-term success. With additional resources, we would be able to achieve a number of things like seamless integration of electronic record-keeping systems, increasing efficiencies for reimbursement from multiple payer systems, and continuing to build the skills of staff to address the increasingly complex issues our participants are facing. There is not a strong voice coordinating supportive housing efforts for the mentally ill. This huge gap must be filled if we are going to be able to support more individuals living in communities across the country rather than institutions. This type of advocacy is important to our organization and one we would strive to fill in Illinois.